Hey, Empowered Nurses, it's Lori Brown, and welcome to our COVID-19 Survival Guide for Nurses and Healthcare Professionals. And so today we have a really special guest, Marie Matienzo, and Marie is a dancer. She likes hula, hip hop, and martial arts. And you're probably wondering why I'm bringing you somebody who loves dancing. Well, the reason is I'm telling you this is because dancing, she found her love of nutrition because she needed to learn how to eat properly in order to maintain her energy to do the hip hop, the hula, the martial arts. So welcome, Marie.
Thank you, Lori. Thank you for having me.
I'm glad you're here. And Marie's also a registered nurse, and I'm trying to bring you as many of us as possible so you can see all the amazing things that we can do aside from traditional nursing. So Marie, tell me about what you do.
Yes, so again, thank you so much for inviting me on to this amazing series that you've created. And so just a little bit about what I do. Well, you know, like all moms, we do so much. But I think what you're asking me is what I do as far as professionally, what I do. Is that what you're...
Right, about the nutrition, right. Yeah.
Okay. So just a little bit of history. So I've been a nurse for about 25 years, and nursing was definitely not something that was on the top of my list to become or to do. But I was really taken by my aunt, who was herself an RN, very successful at it. And she did this all after she was 40 years old. And I was like, so she was a role model for me. And so she says, hey, just be a nurse. And I'm like, okay. And, you know, this is a lady who's been in nursing after she turned 40 for like another 20 years. And then she put her siblings through school because of her nursing. So with that, I said, okay, why not? And so although nursing is not my passion, I found my passion in nursing, and that's in health, wellness, and prevention. So currently I'm an empowerment, health, and wellness coach, and I just love being able to, you know, guide others to do what I've done for myself and with my health, because it's just a matter of, you know, putting your one foot ahead of the other and just going for it. And so that's in a nutshell what I've done, you know, or who I am, what I am. I'm a registered nurse for 25 years, and because of my passion, I'm now leading others and guiding others and mentoring others to just becoming better versions of themselves through nutrition. And those things about me. She said I was a dancer and that I did hula. Currently, I'm doing hip hop. In the past, I've done martial arts. And if you notice, they're all things that deal with movement. And when it comes to movement, you know, guess what? We really get to fuel our bodies with food, and to do it well, I found the best way to do it is to do it with whole foods, because then our body is able to function at its maximum potential. Yeah. So I just love eating. So that's another thing too. I love to eat.
And you're still practicing nursing, right?
I still am. Oh my gosh.
And you're still helping your patient clients with nutrition as well, right?
I do. Every chance I get, I inject every little bit of information about, you know, eating whole foods and everything they can do to eat well, you know, make better choices, make informed choices.
Well, let's talk about COVID-19. I mean, this is really, really scary. And so how can nurses help boost their immune system with the foods they choose to eat?
Okay, wow, great question, especially during this landscape. Okay, so I was just listening to a video actually from Dr. Grieger. He's a lifestyle medicine doctor, and actually the guy I was thinking about was Dr. Barnard, and he was talking about, more than ever, you guys, now is the time to not eat your burger and fries. Why? Well, because it's laden with so much grease. And during this landscape, we want our immune system to really be at its maximum. And the way to feed it is with whole foods, more greens, more veggies. And I'll eat your veggies. I know not all of you are like, I don't want my veggies. But the truth of the matter is, in order for your immune system to work at its maximum potential, we get to really fuel it with the types of foods that will improve our immune system. And so okay, what is our immune system? It's made up of, our white blood cells, right? These are the soldier cells that, get to battle it out with any pathogens that come into our system. And when we fill our bodies with burger and fries that has a lot of grease, it makes for a very slick, slippery environment. So it's hard for our white blood cells, our soldiers of the immune system, to get in there and tackle and fight all the viruses and bacteria, whatever else is attacking our body in our, during that moment. It's hard for them to get at it and to get it out of the system. So if you guys want to really improve your immune system, especially now, forget those drive-throughs. Just, when you get a chance, go to the produce section of your grocery store and reach for your apple, your apple a day. Reach for your green leafy vegetables, your kale, your spinach, Brussels sprouts, they're just wonderful sources of nutrition and a really great way to improve your immune system during this time.
Well, nurses are really stressed at this time, and they want to reach for the comfort foods, and because the public wants to support them, they're bringing cookies and cakes and chocolate and all kinds of stuff to the nursing unit. So, if you're stressed and you want that comfort, that some sense of normalcy, or that things are like they were, what do you suggest?
Oh my goodness. There's so much that I can suggest, but the first thing that comes to mind, for me at least, and this is something that didn't happen right away, but I started with drinking green smoothies, and it wasn't even a recipe that I liked to begin with, but then I found that I took that very same recipe, removed one of the ingredients that I didn't like in my smoothie, which was an avocado, because I prefer to eat an avocado just the way it is, in its full whole form, and just created smoothies, green smoothies that I liked. And eventually I'm able to add more of the green leafy vegetables in there and less of the fruit. But to begin with, go ahead and add your apples, your bananas, your frozen pineapples, your frozen mangoes in there for the sweetness, but eventually your taste buds will just get really acclimated to less and less sugar once you add more of the green leafy vegetables. So for me, that's kind of my comfort food. But you know what? There's also a lot of foods out there that can be comfort food, and it doesn't have to be the cookies, because that's made with butter, that's grease, right? So it's just one of those things where we get to prepare and we get to take care of ourselves and just really be proactive and just take initiative in our own kitchens. There's so many recipes out there, you guys, that you can just start to create your own, like on the weekends or the times that you're off, 3 days in a row for those of you working in the hospitals and, for those 12-hour shifts. So there are ways, you just, you have to want to do it for yourself, for your health. And if you have a family, for your family, right? Because you get to take care of yourself first before you can really take care of anyone else, including your patients, working in the hospitals.
So what if I know when I worked at the hospital, the food was just awful. And except for they made these homemade bear claws that were just out of this world. So, so I would, of course, have to have one every day. And what tips do you have for nurses so that they don't eat the comfort foods at the hospital in the cafeteria?
Okay, other than packing your own lunches, okay, so before this, time of sequestering and this landscape of the COVID-19, we had these salad bar parties or salad jar parties.
Oh.
So everyone would bring in, different ingredients, and it was like an assembly line. So maybe 10, 15 different people got together and, did that. It was an assembly line. By the time we were done, we had 5 bottles of mason jars created so that they were salads for every day of the week, Monday through Friday. I realize you can't do that now. However, you can still, meal prep. You can still meal prep and prepare and just bring your lunch and bring healthier snacks to your work so that you can grab for that apple, or maybe you can grab for, I don't know, a Kind bar or a granola bar that's, healthier as opposed to a cookie. And you can always learn to say no, to things that are brought in that's not so healthy. But I get it. It's and it's not about willpower, you guys. It's one of those times where you get to really dig deep and consider, why is it that I shouldn't reach for that cookie? Why is it that I shouldn't reach out for that brownie? So part of it is going back to yourself and asking why. And if you can go to that place, and if you can, just be strong that way, because, I'm doing it for this and I'm doing it for that, forget the willpower, you can throw that out the door.
Mm-hmm.
But if you can go back to your why, that could be a possibility. That could potentially get you through, saying no to that brownie or to the blondie or to whatever other wonderful tasty things that come across your break room in the staff break room at hospitals.
So I love what you're saying. Begin with that mindset, with your vision of why, because that's going to carry you through better than that momentary, ooh, that sounds really good. You just happen to, well, why am I doing this? Because I don't want slippery white cells, as you say. And that's a pretty compelling reason to eat healthy.
Yes, and Lori, here's what I found in the past, when I would just have that little taste is not enough. What tends to happen is, and they make these little bite-sized pieces or bite-sized packaged, snacks and candies. But what I found in the past is when I even bother to taste or even eat the small package, my gut was talking to my brain and telling my brain, and then I reach out for it. It's like, then the whole day is like, it's just all messed up. So that's the thing too that you battle with, is if you even get a little bit, and then it's just the cycle. So if you can stop yourself right there and without even getting near it, I think you're better off. So don't even taste it. Now, however, I have to say, if you are when it comes to nutrition and you've done really well and you're where you need to be, okay, go for it, but realize that there is the chance that instead of just eating that little piece, you might get tempted to eat another piece.
Yeah.
Yeah.
I'll start tomorrow.
Yes.
And tomorrow never comes unless I have that big vision of what it's going to be like. So I am on the COVID diet right now because
what does that entail?
It just means I don't let the enemy in the house, and since I can't go out really to go get anything that's not healthy, it's a good opportunity for me.
Oh my gosh.
So and since you guys can't be locked up at home, you've got to go to work. You can pack some healthy things and stay full so that you aren't tempted. So what types of things would you recommend?
Yeah. The types of things that I recommend have high water content in them and have high fiber content in them. So if you're talking about just packing things, why not if you're not allergic to peanuts, why not your slices of apples with your peanut butter? A lot of the peanut butters that you can get out there, if you look at the ingredients on the label, it says peanuts. That's the one that you want to buy. Or if it's a nut butter, it's just very simple. It doesn't have all of these other ingredients that you cannot pronounce. Celery is great too, you know, because it's got high water content, it's got high fiber content. You can pack smoothies, put it in a mason jar, and then pack it like in your lunch bag, and then put a pack of ice in there so it remains cold if you don't have a refrigerator that you can put it in. What else? There are like 0-calorie, like if you like texture and you like crunch, there's Quaker Oats makes them. They're like rice cakes. You know, they're very crunchy. If you're like just someone that needs to put something in your mouth and you just want to chew, they make those. So there's that. But for me, I love the apple a day because truly, you know, it keeps the doctors away.
Yeah.
There's some truth in that. So simple things like that. The less packaged, the better, obviously. So, you know, reach out for the fruits and the vegetables.
Well, you've given us some great tips. If you had to summarize the top 3 things that nurses can do or healthcare professionals can do to stay healthy, what would you say?
Just in general, or just keeping with nutrition?
Oh, free
just
choice.
anything.
Yeah.
Okay, so here's the thing. I would say keep hydrated. Keep hydrated. There's a few research regarding water hydration, but what I see, and I think what's possible, is just whatever your weight is divided by 2. That in ounces should be the minimum that you should be taking as far as water is concerned. But especially now, you know, drink water often just to flush your body of anything that goes in that shouldn't be in there. Let it out. So water, and then movement. Keep moving. Even if you're in the house, keep moving. You know, turn on Netflix or turn on whatever exercise video that you could watch and follow, and just follow. At least you're moving, you're sweating it out. Whatever toxins is in there, you're sweating it out. So let's see, hydration, movement, and you know, and there's a lot to be said about mental health. If you haven't already reached out to anyone or connected with anyone, reach out to them. You know, do what we're doing here. You could do Zoom, you could pick up your iPhone or whatever phone you have and do like a live, like what do you call that? Like a you know, you can see their face on the phone and get connected. Because not only is it good for your mental health, it's good for the other person's mental health. Okay, guys, so hydration, movement, and mental health. Connection, really, basically. So those are the top 3 things that I would recommend.
That's great. Now, if a nurse says, well, I move so much at work, you know, is that enough?
Well, are you moving enough so that your heart is actually, you know, it's consistent 30 minutes, that it's actually, you know, you're making that heart muscle move. So there's that little piece. And if you're happy with, you know, your weight, and you feel your muscle is toned and you feel that your movement is fine, then I mean, that's fine. But I always say it's always good to exercise 30 minutes a day, cardio at least 3 times a week to get your heart moving, because you know, heart is a muscle, right? It gets to be strong so it can pump blood to all parts of our you know, parts of our body. So
and pumping all those white cells.
yeah.
Well, thank you so much, Marie, for being here. And to all the nurses and healthcare professionals out there, we thank you, we honor you. We are so grateful that you're taking care of our friends, families, our community. And that's what nurses are meant, that's what we do. We were meant for this occasion. We thrive in crisis, and it's not a good thing, but we are perfectly equipped for it. But just take care of yourself and your health, because if you don't take care of yourself, you can't take care of anybody else. But know that we love you, we support you, we're behind you. And if you're enjoying this video series, please share it to your other healthcare professionals and nurses, empowerednurses.org/COVID. We'd love to share the same information with them. And it's my intention that you use this video series, not just now, but in the future too. If you want just one little pick me up, listen to a video on the way to work and say, oh yeah, tomorrow I'm gonna bring my lunch, or I'm gonna bring some healthy foods, or when I get home, I'm gonna go buy some apples, or whatever that is for you. And or maybe you'll try and take on movement or call your EAP. Mental health cannot be understated at this time. So again, thank you. We love you. And we'll see you on the next video. Thanks, guys.
Thank you. Bye.
Bye.